And now I'm really, really pleased. We're very honoured to have Richard Horton here, and you can read about his many achievements in the pamphlet as editor-in-chief of the Lancet. But what I'd like to say in introducing Richard is that when I was on the Commission for the Social Determinants of Health, he was such a supporter of our work. He also supports the work of the People's Health Movement, so I think he has a deep commitment to equity. So please welcome Richard to Australia.
Thanks very much indeed, Fran, and I'm an editor, so just words today, no pictures. It's very strange that you would invite me to come to Australia to say a few words about a global perspective on equity, because you may have noticed that something very odd is going on in my country at the moment. It's very strange. Our political debate is real for the first time in my lifetime. I was able to vote in 1979 when Margaret Thatcher was elected, and we've spent an entire generation not really questioning some of the fundamental principles by which our societies are constructed. And yet now, capitalism is being questioned. It's respectable to talk about socialism again. Who would have believed that? In his book, How Will Capitalism End? Now, I don't know how many of you have read Wolfgang Streeck's book. Anybody here read it? One at the back. Fran, of course. And Wolfgang Streeck directs the Max Planck Institute for Social Research in Cologne. He writes about, uses a medical metaphor, pathological metaphor, he writes about the multi-morbidities facing capitalism since the financial crisis of 2007-2008. A coalescence of frailties in capitalism and an exhausted armamentarium of remedies. He points to the decline of a US-dominated world order, the political crises facing many countries, the rise in populism in political parties, a weakening of democracies because of globalization, social fractures, ecological pressures, even threats of ecological catastrophe. Now, whether you believe Wolfgang Streeck's diagnosis of this being the final gasp of capitalism, or maybe it's just simply another hurdle to be negotiated, Streeck argues, and I don't think you can challenge this assertion, he argues that capitalism is certainly passing through a period of uncertainty. The way he talks about it is deep indeterminacy. That's his phrase. And he concludes that this doubt that we have about the future of capitalism means, and I'm sorry to our social science colleagues here, means that all of your traditional economic and social theories on which you've based entire careers of work has now zero predictive power. What's new? That's, I hope that wasn't a medical member of the medical community saying that. We're supposed to be building bridges here. The three apocalyptic horsemen he describes threatening the future of capitalism are growing inequality, declining growth, and rising debt. And this is the crisis in a system that was once supposed, in Francis Fukuyama's infamous, notorious phrase, the end of history. It's a system that, according to our Prime Minister, Theresa May, has been, in her words, just a few weeks ago, the greatest agent of collective human progress ever created. Now, even if you don't subscribe to Streeck's dark vision of incipient civilizational collapse, there is very strong empirical evidence that something has gone badly wrong with the system that our health services and our research infrastructures have so depended upon. Writing in Science magazine in April this year, a group of Stanford and Harvard economists and sociologists published a paper entitled "The Fading of the American dream. Now, they define the American dream as the idea that one's children could expect to do better than we have done. In other words, that they would have a higher standard of living than our standard of living. They called this aspiration, in their technical language, absolute income mobility. And rates of income mobility fell from 90% among children born in 1940 to around 50% for children born around 1980. A dramatic fall in that idea of the American dream. Indeed, the American dream had become something of a nightmare for a large part of America's middle class. Two theories exist as to why the American dream is dead. One is that simply lower economic growth has produced less material wealth to go around for a new generation. And the second theory is greater inequality in the distribution of the benefits of that growth. Well, they did a lot of complicated modeling with many equations that I didn't fully understand. And the conclusion they drew from the available evidence was that the cause of the end of the American dream was the growing inequality in American society. And to revive that dream, and indeed it could be revived, to revive that dream, addressing inequalities in the distribution of wealth needed to be the overriding political goal. Economic growth alone is not going to be enough. It seems that in the present White House, they didn't read that particular paper in Science. There's no understanding in the American policy community, dominant at the moment, that that should be the overriding political goal. So the American dream is moribund, but perhaps so the British dream, the French, German, Italian, Spanish dream, and maybe even the Australian dream. These are challenges that we all share across our communities. And indeed, I think, again, even if you don't fully buy into Wolfgang Streeck's civilizational collapse idea, we can say that now is a schismatic moment in modern human history. Now this collapse in opportunity and indeed hope manifests itself in worse health outcomes, with exquisite sensitivity. From rising mortality in white non-Hispanic Americans in the Rust Belt of the United States, as so comprehensively documented by Anne Case and Angus Deaton, to what is nothing less than the sub-citizenship that afflicts victims of austerity because of their disenfranchisement and dispossession from society, and the impact that that has directly on their health. In other words, the way you could think of it is almost the embodied outcomes of austerity. These political forces, these economic forces, have thrown a great deal of light on the importance of hope as a social determinant of health, and its loss, a form of cultural and social violence that we inflict as a direct cause of premature death and ill health. Now, it wasn't Karl Marx, although I will come back to him later, it wasn't Karl Marx, but a former International Monetary Fund economist, Ken Rogoff, who wrote as long ago as 2005 that the next great battle between socialism and capitalism will be waged over human health and life expectancy. But now I'd like to just go a little bit beyond the subject of equity and to circle around it a little bit in order to fully appreciate its place in the lexicon of health. Because I'd like to ask, what is the relation between equity and another idea central to our concern between both of our communities, and that is justice? To understand justice, we have to agree on the meaning of injustice. And at least to my mind, injustice is composed of three elements. First, issues around equity and inequality, the maldistribution of benefits and burdens and opportunities and obstacles that we share or not. But there are two additional qualities to injustice. The second is exclusion, the denial of some bodies or some groups' recognition, whether that's through oppression, exploitation, marginalization, silencing, or just plain cultural violence. And the second additional dimension to the idea of injustice is disempowerment, which is a specific inequality in power. So if we're concerned about equity, we have to also be concerned about the siblings of equity, exclusion and disempowerment, and this broader notion of social justice. Now let me try and complicate this idea of social justice in a further way, and that is through history, which I'm afraid those of us in the medical sciences are less good at studying, and why this conjunction of academies seems to me so important. It's something that quite simply couldn't happen in my country. One example. In Shashi Tharoor's 2016 book, Inglorious Empire, he dissects the history of British colonialism in India. And to those who argue still, and actually there are many, that Britain's imperial era was a wonderful time of benign and enlightened despotism that brought democracy, the rule of law, free press, railways and cricket to India, Tharoor says no, not at all. From the creation of the East India Company in 1600 under the reign of Elizabeth I, Britain deliberately set out to extract India's wealth in order to fuel its own rise as a global power, while India was systematically deindustrialized and impoverished by nothing less than colonial tyranny and extortion. Indeed, Tharoor argues that Britain ranks with Stalin and Mao for inflicting policies that caused tens of millions, he estimates between 30 and 35 million deaths from famines and epidemics. And the fact that India today has the highest number of deaths of under 5 children. 1 in 6 deaths in the world of under 5 children takes place in India. 865,000 deaths estimated for last year, has a direct connection, can be directly traced back to the deprivations and depredations caused by what Tharoor describes as Britain's colonial Holocaust. Now, the influence of history isn't only about 1600 to the 1940s. It's also very relevant today. Let's take countries in Africa as a modern example. The orthodox economic view, and since economists reign supreme in global health, far more influential than any health community, I say that with a slight chip on my shoulder, the dominant view in international development policy is that from the time of decolonization in African countries in the early 1960s, they have been largely failed states and it's their fault. Those failures can be attributed to terrifyingly bad governance and weak and corrupt institutions. But another economist, Morton Jervin, actually took the trouble to study the data. And in his book, recently published on Africa, he tells a very different story. That from decolonization to the late 1970s, actually many African nations coming out of colonization actually grew faster than countries in the rest of the world. And then in the 1970s, 2 events happened that changed the trajectory for those African countries. One was oil price shocks, and the second was structural adjustment. And as is well known, but is still repeatedly denied by economists in the World Bank and the IMF. In exchange for loans, African countries were forced to cripple their economies through liberalization and de-invest in public services such as health and education. And the result was what you would predict, that many African countries simply collapsed under the pressures of those externally imposed shocks, and totally opposite to the orthodoxy in international development policy and history, it was those shocks themselves that created the conditions, the incentives for poor governance, corruption, and obliterated public services. We have the history, as told today, exactly 180 degrees the wrong way round. So if we're truly going to understand equity and social justice in an international context, we have to account for the present crisis of capitalism and where that is taking us in our discussion about the foundations of our political economies, the erosion of hope, the erasure of opportunity, the legacy of colonial and now neo-colonial history, the misleading contemporary narratives of global health and international development, which I'm afraid we collude in, and I include myself and the Lancet in that, and their damaging effects on human health and well-being. So what should we do? That's fine. That's the diagnosis. What do we do about it? We have to adopt a people-centered approach to equity and social justice. Not only investing in saving lives, but in securing lives. There is almost a fetishization of focusing on life expectancy, and we've seen it in some presentations today, and I understand why we do it. About survival, about preventing mortality, but almost no serious attention to the qualitative aspects of what it means to be a human being. And it's certainly true that investing in areas such as early child development, education, nutrition, takes an immensely long time, and one will not get rapid benefits from those interventions, possibly, although I'm not sure how good the evidence is on that. The goal that we have internationally is going to be made more difficult because of the Sustainable Development Goals. 17 goals, and where I sit in the health community, we had our goal. We succeeded in getting our goal into the 17. It was touch and go, but we got one. Number 3 is my goal. I hold it close to my heart. And I don't care about all the other goals, because I've got sub-goals and indicators and targets within my SDG 3, and I've got to focus on that. So you know what? Poverty, SDG 1, that's for somebody else to be concerned about. Hunger, SDG 2, somebody else. Education, 4, somebody else's problem. Gender equity, 5, that's not my issue. You see how we're creating, over the next 15 years or so, a recipe for complete global failure. Because if I am only concerned about reducing premature mortality from non-communicable diseases, as important as that is, and I'm not concerned about building bridges with those concerned about hunger, gender equity, and other areas within the SDGs, I will ultimately fail. My little bit of success will not be sustainable, and I will not achieve what I've hoped to achieve. So the first thing we have to do in this people-centered approach that I'm arguing for is that we have to look for the linkages between the SDGs. Victory for sustainable development will come at the interstices of the Sustainable Development Goals, not with any one goal itself. And we are so badly set up to work together in that way. A second area is, and we haven't talked about this group very much today, and that is the absolute centrality of young people in the future of our planet. 1.4, 1.5 billion people are the next generation today for our planet. And do we spend any time including them in our discussions? Have we really oriented our health, economic, political policies and systems to thinking about their future Not at all. Not at all. And indeed, and I mentioned this yesterday for those of you who are here, is two great Australians, George Patton and Susan Sawyer in Melbourne, who have led the movement for the global movement for adolescent health by publishing a commission in the Lancet in 2016 that is now beginning to light a touch paper to try and transform the way we think about intergenerational equity. Third, we do have to consider this issue of the biggest burden that's threatening our populations, and that is non-communicable diseases, which account for 70% of mortality today, but not in the way we think about it. We have this dreadfully reductive approach to non-communicable diseases, which is summed up in the most horrible way, 4 by 4. 4 diseases and 4 risk factors, which is supposed to set the agenda, totally excluding mental health, totally excluding dimensions of gender in that health, completely excluding adolescent health, and of course non-communicable diseases and mental health, absolutely central to thinking about the future of adolescence. Again, we have imposed a biomedical perspective on our thinking of non-communicable diseases that is destroying any opportunity for a unified transgenerational life course approach to this particular threat that we face. A fourth area is, and I mentioned, our fetishization of life expectancy and survival. We need to think much more deeply about the meaning of well-being. And by well-being, I don't mean the simplistic happiness agenda. I mean thinking about what it is to be a human being in our world today. Well-being is at least 3 things. Yes, there is an element, a hedonic element of happiness to it, but there are 2 additional elements that are so important that we don't talk about, certainly in the medical community. One is, in a sense, looking backwards over our lives and thinking about the satisfaction we have for what we've done, the families we've been part of, the relationships we've had, the work we've done, our living. And the second is more about looking forward, and that is, what is the meaning and purpose we ascribe to our existence in society? As we've seen in those Rust Belts of America, when you strip out that meaning and purpose, you're left with a social rawness that lays prey to the worst elements of the extreme right. We need to put the idea of meaning and purpose and life satisfaction back at the center of our concerns in health. And finally, and this is why it's important I say this in front of you, we have to find our voice. And I don't mean our technical voice. I mean our political voice. What is our political voice, and what is the political voice of these 2 great academies? Now, I've almost finished, not quite. I mentioned Karl Marx in passing earlier, and next year is a big year for all of you Marxists. Because on May the 5th, 2018, it's his 200th birthday. Wolfgang Streeck, perhaps with Marx in mind, reflected on what might follow the collapse of capitalism that he so looked forward to. It wasn't socialism, though. It wasn't socialism. It was what he termed an interregnum, a period of prolonged social disorder, what he termed an age of entropy, something less than a society, dominated by fear and greed, and we're beginning to see some of that today, undergoverned, and suffering an erosion of public infrastructures. Yes, we should certainly recognize and acknowledge the enormous material benefits that capitalism has brought to some, but we also have to acknowledge its costs too. And here there are parallels with the birth of the journal that I am presently responsible for, the Lancet. In the 17th and 18th centuries, those years were illuminated by the great hopes of enlightenment. And yet enlightenment did not bring light. Enlightenment brought poverty, inequality, workhouses, and debtors' prisons. In the 19th century, there was a rebellion against the failure of those Enlightenment values, the disappointment and disillusion that people felt about Enlightenment. And that period was called Romanticism, a search for the imaginative identification with the dispossessed, a radical period of political reform. Now, the Lancet was founded at the height of Romanticism, the Romantic movement in 1823. And now we have reached a similar moment in human history in the early 21st century. The trust that we put in science and technology to alleviate suffering has delivered enormous benefits, yes, but science has also failed to address, let alone remedy, some of the deepest inequities and injustices of our time. It's time for a 21st century romantic revolt. Now, I'm no prophet, but what might this rebellion look like? And here I turn to another Australian, the Australian human rights lawyer Julian Burnside, who in his book published this year, Watching Out, Reflections on Justice and Injustice, invites us to consider two responses. First, the protection of fundamental rights and values, ideally through a legally enforceable Bill of Rights in every nation, which you don't have, and we're about to throw away as we Brexit the European Union. And second, we have to think about how we fix our political system, a system that's broken as evidenced by everything around us, from Trump to Brexit to Le Pen to the AfD in Germany to the recent vote in Austria, and as somebody pointed out to me yesterday, the still alive Pauline Hanson. Julian Burnside writes this: "Injustices that are avoidable but tolerated are like canaries in the mine. They are a warning of worse things to come." So my invitation to the two distinguished academies here today is to ask yourselves, what is your response to these predicaments? Do you simply watch, describe, observe, follow meekly and quietly, passively noting, publishing, with perhaps a little anxiety, the ongoing demolition of the social contract between people and government? Or do you use your authority, your concern for evidence, your commitment to values of independent inquiry and conscience to resist and to protect and to strengthen the communities that you inhabit, on which you depend and which you and I are so thankful for? In Graham Greene's The Quiet American, he writes that innocence is a kind of insanity, and that sooner or later one has to take sides if one is to remain human. So are your two academies insane? Or will you take sides and prove that you are human? Now's your moment to decide. Thank you.